نطلع على الهواء يا دكتور.
نعم.
دقيقة بس، احنا على الهواء الحين يا دكتور.
السلام عليكم ورحمة الله وبركاته. أسعد الله مساء الجميع بكل خير، ومبارك عليكم الشهر الكريم، وأشكر الجميع من حضر اليوم في البث المباشر لحضور لقاء ومناقشة رسالة الماجستير للأستاذة رابعه اليمني. فإن شاء الله هتكون البث المباشر نصف ساعة وأكثر قليلا، بعد ذلك سيتم إغلاق البث ليكون هنالك إن شاء الله مناقشة مغلقة. وشكرا جميعا، وتوكل على الله رابعه، والتوفيق.
الله يعطيك العافية. السلام عليكم ورحمة الله وبركاته. مبارك عليكم الشهر جميعا. معاكم رابعه عبدالعزيز اليمني، طالبة ماجستير في جامعة الملك سعود as a clinical dietitian in King Fahd Medical City. Today, inshallah, I will present my thesis topic, which is about the dietitian's enteral feeding practices, obstacles, and needs during the management of critically ill patients in Riyadh hospitals, a qualitative study. So, our outlines for the day, we will start with the introduction, and then we will go through the literature review. We will highlight some topics including critical ill patients, enteral feeding guidelines and protocols, international guidelines and guidelines development. We will highlight some of the current practices, and we will highlight gap in the literature review, aim of the study and research approach, result and discussion, and we will end up with the recommendations and conclusion. Okay, so malnutrition is a devastating and highly prevalent condition among hospitalized patients, especially critically ill patients. In 2017, a cross-sectional study conducted at King Abdulaziz University Hospital, Jeddah, showed a high prevalence of malnutrition or risk of malnutrition among hospitalized patients, estimated to be 76.6%. Malnourished patients' negative outcome can result in higher mortality and morbidity risk, increase the infectious complications, greater length of hospitalization stays, cost, readmission, as well as impair the quality of life. Malnutrition raises difficulties on decision makers and healthcare practitioners to keep up with its negative complications and consequences. Consequently, decision makers, governmental healthcare and organizations must accelerate their capabilities to take an action in order to manage the high burden of malnutrition. Actually, nutritional adequacy is one of the essential elements in a comprehensive therapy that may affect on the survival of severely ill patients. Critically ill patients who admitted to the intensive care unit ICU often struggling the hypercatabolic state during severe illness and stress, thus requiring nutritional support. Nutritional support therapy is one of the approaches that aim to prevent and treat malnutrition. Also, maintain a nutritional status within optimum limits. However, the hospital settings present many challenges for providing the nutritional support enterally. Thus, careful enteral feeding planning and monitoring are crucial to overcome the challenges and maximize benefits. Hence, guidelines and protocols are standardized the nutritional practices in order to improve patients' nutritional status, reduce the length of hospitalization duration, and save costs. So, regarding literature review, critically ill patients have critical illnesses which are associated with stress-related metabolic responses that increase the nutritional risk and complicate the tube feeding process. The stress-induced metabolic changes lead to higher catabolic rates, systematic inflammation, multiple functional changes in the body systems, beside other related complications. Consequently, the enteral nutrition plan should cautiously address these changes and aim to provide the optimum nutritional support, improve the catabolic state, and reduce stress-related complications. Enteral feeding guidelines and protocols Actually, guidelines established to serve as a guide for healthcare practitioners through providing a clear standards as benchmark, which represent a wide range of performances related to care service. It is dedicated in improving the patient's nutritional care plan in most circumstances, as well as assure the patient's safety. These evidence-based guidelines effectuous for addressing the practitioners toward practicing a competent nutritional care. Actually, regarding the international guidelines, there are existing international guidelines published to support the best nutritional therapy practice, especially for enteral feeding field. The most routinely followed guidelines for enteral feeding are ASPEN, ESPEN, and the Society Critical Care Medicine. According to the National Institute for Health and Care Excellence, defining the guidelines as a method of assuring that patients' care should be according to a guideline which will effectively fulfill the desired outcomes. So, one of the initial steps toward developing a guidelines is to consider the current scope of needs, gaps, and issues. The purpose of identifying the scope is to define the targeted group as well as compare between different practitioners group implementing the same service. After identifying the scope, research questions should be developed to appropriately cover all the aspects of the scope and addresses the practitioners' experiences, practices, reviews, and recommendations. Actually, the primary source of evidence for addressing this type of data and information could be achieved through a qualitative study. Qualitative study could aid in guidelines development that will serve as the foundation for standardizing an effective healthcare practice. Regarding some of the current enteral feeding practices, in a multi-international observational study were conducted in Latin America to investigate about the current nutritional clinical practices in critically ill hospitalized patients. They found that 40% of patients who received nutritional support were malnourished due to failing to achieve targets of energy requirements. This could be related to the inadequate compliance to nutritional support protocols and guidelines for critically ill patients. However, while in a prospective observational study aimed to evaluate patients who admitted to ICU in Brazilian hospital, a total of 185 severely ill patients were evaluated about their nutritional status, and they found that malnutrition among severely ill patients after ICU admission reached above 50%, and they revealed that double greater risk of ICU readmission, 8 times greater risk of death in malnourished patients when compared to well-nourished patients. These findings actually highlight that malnutrition was related to greater ICU readmission and less ICU discharge or even death. On the other hand, variation in enteral feeding practices regarding the timing of enteral feeding initiation was also observed. In a retrospective review conducted to investigate the compliance of nutritional support guidelines in comparison to the actual practice. This study included 37 critically ill burned patients to evaluate the timing of enteral feeding initiation when compared to ASPEN guidelines for severely ill patients who needs nutritional support. They found variation and incompliance to guidelines, which evidenced by the delay of about 16 hours between enteral feeding access and enteral feeding initiation when compared to ASPEN guidelines. Thus, sufficient compliance to the protocols and guidelines is essential in order to optimize early and effective enteral delivery feeding, improve nutritional status, and overall outcomes in critically ill patients. So these studies explains the wide variability in the current enteral feeding practices, which may be adversely resulted in malnutrition. According to WHO, malnutrition represents a double burden at national and international level and should be addressed and resolved efficiently. Malnutrition should to have a fivefold increased the risk of death. In addition, its related complications affect negatively on healthcare institutes, budgets, resources used, and increased cost impair the quality of life at individual and community level. Addressing the issues and needs for healthcare providers could be the key to prevent the burden of malnutrition. Now, regarding the gap in the literature review, actually to our knowledge, there are limited studies investigating about the current practices of enteral feeding during the management of critically ill patients among clinical dietitians in Saudi Arabia. Despite the wide availability of international guidelines to direct enteral nutrition practices, there are no guidelines tailored for the unique healthcare environment across Asia Pacific and Middle East regions, including Saudi Arabia. As we all know, Saudi population have different characteristics and settings when compared to other countries' population. And there is a gap for specific guidelines and protocols tailored for Saudi population. Furthermore, the gap exists regarding studies addressing the current clinical dietitians' enteral feeding practices, obstacles, and their needs. In addition, gap between guidelines and the actual clinical practices also exist. This highlights the essential needs for nutritional guidelines to guide the practitioners toward meeting the critically ill patients' nutritional requirements, as well as standardizing and appropriate clinical practice. Hence, evidence-based guidelines will improve the quality of care as well as life, which will be reflected positively in individual health and overall community. So, regarding our aim for this study is to investigate about the enteral feeding current practices for hospitalized critically ill patients among licensed clinical dietitians in Riyadh, Saudi Arabia, and identify the practitioner needs and underline the related obstacles. Our study design is a qualitative approach was conducted through multiple focus group sessions to gain in-depth understanding of the current enteral feeding practices and discover the clinical dietitians' needs and obstacles during their enteral feeding practice. However, the ethical approval for this study has been attained by the Institutional Review Board, IRB, which is submitted to the Research Ethics Committee at King Saud University. Our participants' eligibility was limited to dietitians who were specialized in clinical nutrition field and practicing enteral feeding in Riyadh's hospitals, either government or private hospitals, in order to represent the differences in practices, needs, and the obstacles that they may face to reach the current situation. Regarding the focus group sessions, the consent form has been received from the participants after their agreement and signature before initiating the focus group sessions. Actually, the focus group sessions were performed through Zoom online private room. All sessions were audio recorded and kept in secure device with limited access to the researchers only in order to facilitate data analysis. Each session was including approximately 5 participants, and each session was last for 60 to 90 minutes. And in order to encourage self-disclosure, participants were stratified considering differences in their working place, experience, and educational level. Actually, regarding the questions, pre-formulated open-ended questions were questions to the participants during the focus group sessions to gain in-depth understanding of the current enteral feeding practices. A total of 22 questions were categorized as opening question, introductory question, transition question, and 18 key questions and ending questions. The key questions general theme was obtained from enteral feeding international guidelines for critically ill patients, and the specific key questions were formulated based on the researchers' clinical experience and international guidelines reflection. Regarding the data analysis, participants were expressed in codes and the audio recorded sessions were transcribed for data analysis. Data analysis was cross-validated by 2 researchers. After that, themes were identified via coding analysis. Additionally, inter-rater agreement of the data's themes was evaluated. Now we will come up with the result. A sample size of 24 participants were recruited through purposive sampling approach who meet the inclusion criteria and included in the descriptive statistics. However, a total of 5 focus group sessions were conducted until data saturation reached, which is indicated through the 5th focus group session when no more data or information was added. And here we will have a look regarding the demographic information. A majority of participants were Saudi and majority of them were female, and most of them have years of experience from 2 to 5 years. 75% were working in governmental hospital, and most of them having bachelor educational level, and half of them almost junior and senior, and majority of them having the SIPAHI and international accreditation. So themes are identified after data collection and analysis regarding the current practices, obstacles, and needs. And regarding the current practices, 12 themes are recognized, which they are evidence-based guidelines or protocol, medical records and screening tools, eligibility criteria for enteral feeding timing and initiation, enteral feeding access site and delivery route, additionally nutritional requirements, and enteral feeding ordering chain, formula preparation and labeling system, safety precaution to avoid overfeeding and aspiration, monitoring aspects and frequency, transition from enteral to oral feeding and evaluating food intake, and finally discharge plan of care. While regarding the obstacles, 4 themes are documented, which they are lack of evidence-based guidelines and protocol, lack of clear dietitian role and poor communication within the multidisciplinary team, also lack of follow-up after discharge, and lack of availability and preparation of the formula. While the needs for other themes are highlighted, which they are national evidence-based guidelines or protocol, clear dietitian role, follow-up after discharge, and accurate preparation of the formula. Each theme was supported actually with sub-themes and participants' comments and quotes. Regarding the discussion part, actually we will highlight some of the discussion points that which they are adopting an international guidelines. Most of the focus group participants emphasize that they are adopting an international guideline in their enteral feeding practices, which is in line with the enteral feeding practices ASPEN and ESPEN guidelines. However, adopting an international guideline does not mean that it is followed and applied by the dietitians, since it's not mandatory and the hospitals are not implementing it as claimed by few of the participants. Also, as evidenced by a retrospective review, aim to monitor and assess the implementation and compliance of evidence-based practice guideline. They found that adopting an international guideline with inadequate compliance and implementation resulted in ineffective patients' outcome. This actually highlights the need for an effective monitoring and surveillance for the actual implementation. Otherwise, there will be no effective patients' outcome for neither adopted international guidelines nor created policy. So, regarding patient eligibility for enteral feeding, as reported by most of the participants, that there were no specific nor clear criteria for identifying eligible patients for enteral feeding. Having a clear criterion or a protocol for detecting eligible patients for enteral feeding is an important aspect of a comprehensive nutritional therapy, especially for critically ill patients, as evidenced by ASPEN and ESPEN guidelines. Furthermore, in a prospective study which aimed to assess whether nutrition support criteria could improve the nutritional support for critically ill patients, they clarified that having a clear criterion for eligible patients to start with enteral feeding resulted positively in respect to the ineffective nutrients delivery and rapid increment of enteral feeding delivery, which contribute to adequately meeting the nutritional requirements for critically ill patients. Concerning enteral feeding initiation and timing, although half of the participants declare that they have a protocol, but they mention that it's not usually followed. Actually, a huge differences in the current practices have been greatly noticed by the included participant, as revealed by European survey conducted to gain in-depth overview of the current practices of enteral feeding for adult patients in intensive care units. They found that many of intensive care units practices do not adopt an international guideline for enteral feeding. In addition, they found variation among European intensive care units and enteral feeding practices. So they highlighted that monitoring the enteral feeding practices parallel with adopting an evidence-based guideline which developed by a multidisciplinary professional team will assure an appropriate, safe, and efficient management of critically ill patients receiving enteral feeding. This is greatly will enhance facilities toward tailoring an appropriate intervention in the direction of improving enteral feeding practices. They conclude that the need for identifying a scope regarding the current practices in order to develop an evidence-based guidelines for enteral feeding practices is essential for European intensive care units. On the other hand, regarding the dietitian's orders, most of the participants revealed that the dietitian's orders must be approved by physician first to be effective, which is in line with SIBAHI standards, but at the same time, it's an obstacle that they face because when they are waiting for the physician's approval, it may delay their orders and affect negatively on enteral feeding delivery for the critically ill patients, as evidenced by a recent retrospective study which aimed to measure the effectiveness of providing registered dietitian writing order privilege for enteral feeding administration in critical care units and to be effective directly without the physician's approval. They found that significant improvement in protein delivery in ICU patients, since the adequate nutritional support is allied positively with the patient's improvement and outcome during clinical illnesses, effectively accelerating the nutritional care plan implementation will contribute toward positive patient's outcome. And they highlighted the essential needs for giving the dietitians order privilege to improve feeding delivery. In addition, regarding the dietitian rule, the lack of clear dietitian's rule and poor interdisciplinary team communication was also mentioned by most of the participants as an obstacle. They reported the needs for clarifying the dietitian's role for each member in the multidisciplinary team. As illustrated and recommended by ASPEN guideline, a structured nutritional support service must include the registered clinical dietitian, physician, nurse, and pharmacist. Each member of the multidisciplinary team must be aware of each member's role and follow a clear standard of practice and responsibility for each discipline in order to achieve a competent healthcare service. Regarding a patient discharge plan of care, focus group participants reported differences in their practices of performing the discharge plan of care. Besides, they draw attention to the needs for following up with enteral feeding patients after discharge in order to assure adequate nutritional intake. While few of them reported the absence of follow-up after patient discharge as an obstacle they faced. However, recent narrative review revealed that post-ICU discharge plan of care is essential to reduce the possibility of patients from becoming a victim and delayed recovery due to inadequate nutrient intake. Additionally, according to ZBAHI standards and GCI policy, individualized discharge plan of care is a must to be established and prescribed to ensure and maintain nutritional targets post-ICU discharge. Now we will highlight some of the strengths and limitations that we found. To our knowledge, this is the first study that identified the current clinical dietitian's practices of enteral feeding during the management of critically ill patients in Riyadh's hospitals and identify the practitioners' needs and obstacles. However, the generalizability of the study's results is limited for the local primary research needed in order to clarify the evidence. So, to conclude, critically ill patients are at high risk of being malnourished due to stress-related metabolic responses and higher catabolic rate. Differences in enteral feeding practices in different hospitals settings have been noticed. The essential needs for developing national evidence-based guideline tailored for local population characteristics are greatly highlighted. The needs for local primary research and nutrients reference value are important in order to develop such a guidelines. However, evidence-based guidelines will help decision makers in standardizing a protocol for enteral feeding in Saudi hospitals, which will benefit local accreditation agency for quality assurance purposes. So, according to the Saudi standard classification of educational specialists and occupations, providing nutritional care plan, including enterally fed critically ill, is one of the tasks and roles of graduates from clinical nutrition discipline. So, it is recommended that all concerned institutions and sectors, including educational sectors, training sectors, and practical institutions, modify their standards, protocols, and competencies accordingly. Hence, national guideline should be compatible with defines dietitian's role and clear standards of practice and responsibility for each discipline in order to achieve a competent healthcare service. Thus, standardizing the dietitian's enteral feeding practices will not only improve the health outcome of patients by enhancing their nutritional status, but it will also assist in reducing the economic burden on governmental health institutions by cutting budgets and shorten possible length of stay. Here are my references, and thank you for your attendance and listening.